New COVID-19 cases dropped dramatically in the United States. Plus, more than 1.7 billion doses of the vaccine have been administered globally. But hotspots still remain. When will it end? Hello, I'm Anand Naidoo, and this is The Heat. The number of people vaccinated from COVID-19 continues to rise in some countries. The European Union says it's on track to inoculate over 70% of its adult population by September. However, people in rich countries are getting vaccinated more than 30 times faster than those in poorer countries. Latin America and India continue to struggle against rising death tolls. Well, there is much to talk about. Let's get straight to our panel. Arthur Dong is a professor at Georgetown University's McDonough School of Business. Dr. Bharat Pankania focuses on infectious disease management as a senior clinical lecturer at the University of Exeter. Also with us, Gustavo Ribeiro is a journalist and founder of the Brazilian Report, and scientist, philanthropist, and author William Haseltine is the chair and president of Access Health International. Thank you, everyone, for being with us. And Bill Haseltine, let me start with you. Let's start with the vaccines. Looking at some figures here. Here in the United States, 50% of adults are now fully vaccinated, and it could be about another 4 months before 75% of all adults are fully vaccinated. Globally, as I mentioned, 1.7 billion shots have been administered. What is your assessment of the progress that's been made and the challenges that remain?
Well, first of all, it's a remarkable success. The vaccines, especially the Moderna and the Pfizer vaccines, are extremely effective. They have very few adverse events, and it's just a marvel of science. It's a marvel of public health to get that many shots into that many people. Of course, the challenge is what to do with those people who are hesitant. And there's a wide range of people who are hesitant. It's important to have as many people vaccinated as possible to drive down the infection. So the good news is that it's a great vaccine. It's being used by a lot of people. The bad news is not everybody's got it, and it's going to be a hard slog. Next job will be to get children vaccinated, and we'll probably start that late summer, children between the ages of 12 and 6. That's going to be important because even though they don't get that sick, they are an important vector.
Bill, I mentioned that figure of 75% being vaccinated in about 4 months. I mean, could that happen? Because we know that there is significant resistance to vaccination.
It could happen if we vaccinate children the way people are hoping to. It's really important, I think, that people are now, that it's coming into focus, how important it is to vaccinate children. There was just recently an article that came out that measured the amount of virus that are in children as compared to adults, even very young children that don't get very sick. They have just as much virus in them, just as much virus leaving them as an adult does. So they are definitely a source of infection,
right,
even if they don't get that sick. So it is important to do those. And if we get the children, we can get probably close to 75%.
Right, and Bill, success here in the United States, but what's your view of the situation in India right now, which has become the epicenter of this pandemic? There was some speculation earlier this week that the country may have, or the second wave may have peaked already.
Well, it looks like it might be peaking, but we don't really have a good fix. Some people say it's over 100 million, some 200 million. The high estimate is 600-700 million people infected, with several million dead because they're not counting. So we don't know what's actually going on there. I can tell you, I have offices in India. Everybody I have working for me has relatives who have been sick or died, and we've had people who work for me who have died, and their relatives have died. It's a really desperate situation there. One hopes we get a lot of vaccines. One hopes that the situation ebbs, but don't take our eye, as one of our panelists will tell you, off South America. The pandemic is about 200,000 people a day in South America, if you take the whole continent, and it's rising. It's not going away. So India and all of South America are just about at a par now.
Bharat Pakania, the European Union expects to have more than 700 million doses by the end of June, and there is a figure I saw which says that they could have 1 billion doses by the end of September. Here's the European Union Commission head, Ursula von der Leyen.
By the end of the week, over 300 million doses of vaccines will have been delivered to member states. And in June, we expect more than 400 million doses. So we are on track to reach our goal to have enough doses being delivered to vaccinate 70% of the adult population in the European Union by the end of July. If we continue like this, we have confidence that we will be able to safely reopen our societies. So we must now focus on consolidating this progress.
So, Bharat Pakania, cases in Europe have fallen by 60%. There's also been a decline in the number of deaths there. But the World Health Organization says that it is still very concerned about variants. What do you make of progress so far and these concerns expressed by the WHO?
Well, whilst the United States and Europe are racing ahead with immunizing their populations, the biggest elephant in the room that is not being addressed properly is the runaway infections that we've just heard about from our colleague in the United States, in India and South America, and invariably that infection will also run uncontrolled in Africa. Wherever you have uncontrolled infections and excessive reproduction of the virus, variants can also emerge. And with the emergence of variants, a number of bad things can happen. You may get variants that bypass the vaccines. They may cause more severe illness. They may be more infectious, like the India variant is. We also look forward to a variant that emerges, which is mild, more infectious, more dominant, and less disease causing, but that's just waiting for time. So what I am saying is we need to also immunize in other parts of the world. And we can do that only by making vaccines available in large numbers for other parts of the world as well at the same time. That's what we must do.
Now, absent that happening, Bharat, I'm presuming that the only way you could actually stop the kind of infection in India, say, or Latin America crossing over into other parts of the world, like North America, would be to just completely block travel.
Well, and that's so difficult because it's not only targeted blocking of travel, but it would be blocking of all travel. And that's ever so difficult with an interconnected world. So what we have to do is assist all those countries to suppress their infection. So for example, with respect to India, I have been advising that to bring down their case numbers and keep their case numbers down, they need a shutdown. And having obtained a sustained, strict shutdown and regaining control, the second thing to do is immunize, of course. Immunize at pace, because when you immunize, even with one dose, you reduce the infectivity of people who have been immunized. So a global effort is required, to be honest.
Gustavo Ribeiro, the death toll in Latin America and the Caribbean passed 1 million last Friday. Most of the deaths have been in Brazil, which is where you are normally based, although you're talking to us from France right now. Health authorities in Brazil recently asked for permission to import 20 million doses of the vaccine from India. A previous request, a similar kind of request, was denied. Why has it been so difficult for Brazil to make progress?
Well, the problem is right now, Brazil does not produce vaccines from scratch. So it depends on importing ready-for-use jabs or vaccine inputs. And it has done mainly from China and India. There has been a lot of setbacks. And the thing is, the two facilities that produce vaccines in Brazil have interrupted their production due to a lack of inputs. Now, the vaccination rollout in Brazil has happened through drips and drops. It has, we have faced a lot of hiccups in Brazil. And right now we have less than 10% of the population fully immunized, and new variants are popping up. The so-called Indian variant was spotted and confirmed in Brazil this week, and researchers yesterday announced that a new variant was found in Brazil that is a mutation from the Amazon variant. Right now, we see transmission rates rise in every single region of the country. So we are now reaching winter time in Brazil. And even though winter in Brazil is not as brutal as it can be in North America or in Europe, it will put people more indoor. And at this point, isolation rates are very low. And we are seeing a sort of very dangerous cocktail of low isolation rates, slow vaccination, and new variants popping up.
And Gustavo, what is the complication with getting vaccines into the country? You know, as I said, health authorities there are trying to get permission to bring in another 20 million. A previous request was turned down. What is the problem there?
Well, health regulators in Brazil are known for being quite strict. So there has been regulators have cited problems, for instance, with Russia's Sputnik V. They have flagged some inconsistencies with the Covaxin from India. That's some of the regulatory hurdles. And the governors in several states are trying via the Supreme Court to get authorization to import, but the jurisprudence here has been until regulators green light, nothing can be sold in Brazil or distributed in Brazil.
Arthur Dong, of course, all of this is very closely related to economies around the world. Everybody's looking very closely at which economies will bounce back. We've seen quite a bounce back, of course, in China. But we've just seen a report here, according to CNN and Moody's, the US economy is back to 90%, according to them, of where it was before the pandemic. And I'm wondering, could this be accurate? Because for instance, I'm sitting here in central Washington, D.C., and I know for the past few months, many businesses that were boarded up are still boarded up. There's not many people on the streets at any time of the day. What do you make of that figure, 90% of what it was before the pandemic?
Thank you, Anand. That's a terrific question. There does seem to be some light with regard to the resurrection of the U.S. economy. President Biden's 100-day mission was to inject tremendous amounts of fiscal stimulus into the economy to help unemployed citizens in the United States, as well as small businesses, try to find a way to seek recovery as the economy has been in a sense of dormancy for the past 12 months. And so I do believe that overall the United States economy is starting to show signs of vibrancy and life, and it's certainly showing up in retail figures, in terms of the things that people are buying. And so I am optimistic that we are coming out of this, and we're going to see a very strong end to 2021.
And Arthur, you say you're optimistic. Could we then start seeing people returning to work in city centers like Washington, like New York, places like that?
Yeah, that's the million-dollar question right now, because a lot of observers, particularly in the real estate space, are wondering to what extent will there be a sort of permanency to working from home, as many workers have expressed a preference for having some degree of flexibility in their work lifestyle, and many companies are seeing no diminishment in terms of either progress or productivity as a result of the working from home. So I think to a certain extent there will be a certain degree of permanency as companies rethink how and to what extent people work from a physical office. But I think come by September, when schools start to reopen, I think you'll start to see many companies, and I think already Wall Street has already notified, all the major Wall Street banks have already notified their employees that by July they expect to see most of them seated in their desk, in their offices.
Yeah, I've heard that. Many people, of course, they do like going to work in shorts. They don't want to come back to the office. Bill Haseltine, can we attribute the drop that we are seeing in COVID-19 cases solely to vaccines getting into the arms of people, or are there any other factors at play here, like, for instance, the weather? We're getting warmer weather, especially in the Northern Hemisphere, and people still abiding by mask mandates, socially distancing.
I think you put your finger on it. It's a couple of things. First of all, it is definitely vaccines. Vaccines have made a big difference. We had a big outbreak in Michigan, and I think that has been calmed down by vaccines, which is very good news. But it's also that many people, I can tell you, I'm one of them, that still wear my mask when I go out, and I see many other people in New York City doing exactly the same thing. We're not following the CDC guidelines, even though we're fully vaccinated. We are masked up when we go out in public. And I think that's a sane and safe thing to do myself. I think it's partly the weather, but you have to remember, it can't always be the weather because India is, I don't want to use a word it shouldn't on TV, but it's really hot right now in India. It's pre-monsoon. I've been there and it can get 40, 42 degrees and humid. So that hasn't stopped. Heat doesn't stop this virus. Didn't stop it in the United States last summer. It's a bit surprising for us who've seen other coronaviruses peak only in the winter. So this virus is more contagious. There was a comment about how contagious this can get. Let me just give you a ballpark. The first virus that we actually detected was Wuhan. Let's say that's one. The next one came out in Europe in February last year. That was infectious at a rate of 2. Then a whole bunch of variants, and some of which were Brazil, which were mentioned. I would say we're about 4. The Indian variant seems about 6 or 8. That's a big increment in infectivity. That means it can really drive infections, not just escaping vaccines. If you aren't protected, it can get you. And what's very common now to see is one person in a group will get infected and then everybody gets infected. Mm-hmm. That used to be uncommon. So that's another danger to watch out for the unvaccinated. So the simple answer to the question is, we are lucky it's going down in Europe and the United States. It's a good chunk of that is vaccines, and we need more of them.
Bharat Pankhania, what are your thoughts on these variants?
Well, we have to suppress them. And as our colleague has said, they are more infectious. The good news is that they haven't been found to be more disease-causing. But that doesn't mean we sit and rest, because it could emerge that not only is it more infectious, but it is also more severe disease-causing. So we need to be careful. And of course, they can, after several mutations, if we are unfortunate enough, even bypass the vaccines. At the moment, the evidence indicates that they are not bypassing the vaccines. Going on to the subject of coming back to sit and work at our desks, I would say that's going to change. That may not happen altogether.
So people could still be going to work in their shorts, right?
Indeed, from home, yes.
Okay. Now, it seems that COVID-19 has also been making news in Britain, where you are right now, for all the wrong reasons. We had a former senior advisor to Prime Minister Boris Johnson. He had some very scathing words for the government of Prime Minister Johnson and the manner in which they handled the pandemic. It's very political. The man who leveled that criticism is called Dominic Cummings, and he said the government had, in his words, failed. But Johnson is defending the government. This is what he had to say. Let's listen.
Mr. Speaker, I don't think anybody could credibly accuse this government of being complacent about the threat that this virus posed at any point. We have worked flat out, Mr. Speaker, to minimise loss of life, to protect the NHS, while they have flip-flopped, Mr. Speaker, from one position to another. Mr. Speaker, we have got on with the job of protecting the people of this country from one of the worst pandemics in living memory, if not the worst in living memory. We have turned the corner, and it is no thanks, Mr. Speaker, to the loyal opposition opposite.
So, Bharat, a very robust defence there from Boris Johnson, but what did you make of his handling of the pandemic?
Well, people like myself and many of my colleagues have been applauding the government when they did the right things, such as immunize at pace and allow the existing health infrastructure to deliver the vaccination, i.e. the primary care, the general practitioners. On the other hand, of course, the United Kingdom made mistakes, such as we went into the lockdown late so that we came out of the lockdown early. We allowed the surging in number of cases, and with respect to our test and trace and isolate system, we centralized it, and it never worked as well. So of course there were mistakes made, and they're clear for anyone to see and examine that we could have done better. We're a first world nation. We are not lacking in experts in advising what the right things to do were, but the government took some decisions which were very centralized and very not in line with standard infection control, outbreak control practices.
Gustavo, both China and the United States are shipping vaccines to Latin America. Chile, El Salvador, Brazil, and Uruguay are relying almost exclusively on Chinese vaccines. More vaccines are expected from the United States. We did hear President Biden talk about that a few days ago, in which he was saying that he would make available 80 million vaccines to be exported to other countries. But in Latin America, where do you see the biggest need, and what are the major challenges?
Well, we have needs all over Latin America. I think with the exception of Chile, every country is facing a lot of hiccups here. And the problem here in Latin America is that vaccines might be the only way out, because it's nearly impossible at this point to enforce social isolation rules. We were talking about going back to the office, but in Latin America, most people don't have an office to work. They cannot work at home. They have to go out, and they have to earn their money on the streets every day. Brazil, for instance, has 40% of its workers unregistered. These are folks that cannot afford to stay home. And at this point, there's a lot of pandemic fatigue. In Argentina, for instance, the government has enacted a 9-day lockdown, but it's very hard to enforce at this point. So we are seeing, for instance, places like Haiti with no vaccination whatsoever, some places in Central America that are with less than 1% of their populations vaccinated. But even big countries such as Colombia or Brazil or Argentina are still having a lot of problems to roll out in a constant manner and in a fast enough way.
Arthur Dong, looking a bit more at the economic impact, there's been some studies which suggest that the pandemic will leave very deep scars on the global economy. In fact, there is one report which says that with all the automation we're seeing right now, more than 100 million people in 8 of the world's largest economies may have to actually change jobs, change occupations by 2030. And the people who are less educated, the female workforce, will be hit hardest by this. What is your assessment?
Yes, Anand. Certainly COVID and the lessons of COVID has certainly catalyzed structural changes that are occurring all over the world, automation being one of them. And so I do agree to a certain extent that this report sort of lays out that, certainly if you look at, and COVID hasn't treated all businesses equally, as one of our guests pointed out, that, if you are in an economy where you are either a shopkeeper or, running some kind of a food establishment, well, you have no office to go to. And therefore, if you don't, return to your street level, occupation, you're not going to eat. And so, this lays bare the sort of inequalities and exposes the inequalities worldwide and the impacts, the economic impacts of COVID around the world. But I think certainly there may be some permanent structural changes as more and more companies, begin to automate both service industries as well as manufacturing industries. And that may fundamentally have some major changes in terms of the overall composition of the labor force moving forward.
Bill Haseltine, of course, many lessons have been learned, and right now we're hearing that the President of the European Council and the World Health Organization are pushing for a new international treaty to prepare for the next pandemic. They're trying to avoid the kind of vaccine scramble that we are seeing right now. Here is the President of the European Council, Charles Michel.
This treaty on pandemics would be rooted in the constitution of the World Health Organization. It will support the principle of health for all. And through this treaty, our main goal is to foster a comprehensive approach to better predict prevent and respond to pandemics, to strengthen global capacities and resilience, to ensure fair access to medical solutions, and to bolster international alert systems, data sharing, and cutting-edge medical research.
So, Bill, the United States is opposed to the timing of this right now. We will only see discussions take place in November. But what do you think of the concept of it?
Well, first of all, it's music to my ears. I've been saying the same thing since 1985 in the middle of the AIDS pandemic, which, by the way, is not over. Not only that, I've created a foundation which the motto is access to high quality, affordable health for all. That's what my foundation does. We work around the world for that. To hear that level of support at this time is very welcome news. Let me say that there are many parts to what you just heard. One really important point is capacity building. I'm doing everything I can, working with my friends in international banks, AAIB, the World Bank, regional development banks, to try to build the capacity within countries. You heard one of the speakers say, we don't have the capacity to make vaccines in all of South America. That is unacceptable. The same is true of all of Africa. So we need capacity distributed around the world to make vaccines. So we're not in a situation where a president or a prime minister has to say, I'm going to vaccinate my people first before I help you, which he will probably say. It should be vaccines for everybody made regionally, capacity building. And it's also capacity building across the board for surveillance, for treatment. And let me say, there's a whole nother way that we work on controlling pandemics. It's not just with vaccines, it's with prophylactic drugs like HIV. That we're getting to the point where you can prevent infection, not just with vaccines, but with drugs. So multimodal therapy and prevention is in our future, thank goodness. And we need it distributed globally.
Bharat Pankhania, I've only got about a minute left, but I want to address this, and that is, as we try to get back to some kind of normality, Europe says it will remove all travel barriers with what's called a digital certificate system. There'll be no more quarantine requirements for vaccinated people. How will this work, and do you think it will keep people safe?
Well, it is again going to be a clear indicator of inequalities. So whilst you may remove barriers just because you have been fully immunized and you've got the documentation to prove it, fully immunized people can still be transmitters of infection. And what about the people in Africa, South America, India, elsewhere who have not been immunized? What are we going to do with them? So we really need to work with global interests at mind rather than saying we are going to create passports for our people only. Our colleague who just mentioned about the vaccines, we need to make vaccines globally and available globally.
And that's where we have to leave it. Thanks to all of you for being with us. That is it for this edition of The Heat. I'm Anand Naidoo in Washington, D.C. Thanks for watching.